Now, 84 healthcare facilities in KwaZulu-Natal have been damaged in the recent flooding in the province. The floods left 440 people dead, with another estimated 40,000 displaced. Hospitals and clinics are struggling to provide normal services because of the damaged roads and the fact that there are regular electricity outages due to damaged infrastructure. The lack of water and electricity means that maintaining hygiene in healthcare facilities is compromised, and this may lead to outbreaks of typhoid and other illnesses. Now, joining me in studio is Lerato Mthunzi, who's the General Secretary of the Young Nurses Indaba Trade Union. Lerato, welcome to Newsfeed PM. Now, we've seen the damage that has happened to KZN, but before that, austerity measures over the years have continued to cripple the healthcare system in that region. We know that government's decision to implement those austerity measures, especially during the time of COVID, worsened the situation. What seems to be the biggest stumbling block in government just giving resources to these areas?
Thank you so much, and good day to your viewers. I think the biggest thing that we are looking at is the Department of Health not being in charge of itself. With the posts or vacancies that must be created for the Department of Health, their dependency is always on Treasury. So the biggest excuse that you'll get from those who are at the helm of healthcare is to tell you we do not have vacant funded posts because we were only given this much by Treasury. Now, you would witness that year in and year out, the budget for health at national and provincial levels keep on being cut. I mean, during the pandemic, we saw for funded posts, for just covering compensation, the budget moving from 2.2 billion to 1.1, a 50% cut. That is telling you a story that we are still struggling with a disaster. And I think the KwaZulu-Natal floods are saying we are yet in another disaster and we do not have hands on deck. We don't have people to man those beds. We just simply do not have people that we are able to pay.
Speaking of those numbers, I mean, Dr. Joe Phatla, who's the minister in the health ministry, has said that, well, he gave a written reply to Parliament that last month there were 10,831 vacant nursing posts in South Africa, and 3,603 of those posts were in the province of the KZN.
Now, the big question becomes, why are we sitting with vacant posts which are funded if they are there and we are not replacing them? I mean, KZN has paraded in 2020 during the pandemic a lot of healthcare workers in a stadium where people were coming to beg for jobs. We are looking at the provinces not being able to absorb community service nurses that we've trained with taxpayers' monies year in, year out. We are looking at them not being able to absorb those who have completed this community service, and also those who are actually saying we are unemployed and we're sitting at home. And when you see the staggering numbers that are reported, because it's a parliamentary question, it actually icks you, because you want to ask yourself, why are we not replacing when we are actually giving such a substandard care to our people?
So it's not that the talent is not there.
Look, our country produces the best nurses, the ones that are wanted by all countries. In fact, brain drain remains one of our biggest problems. But when you look at it, we train them as efficiently as we can, but when they're supposed to serve communities, we are unable to give them those jobs, and we let them go to private sector and let them go abroad. And that tells you that we don't have foresight and we don't plan ahead as the Department of Health.
So, Lerato, really, what is the problem? I mean, we can't be saying that we have the talent that is there. We're assuming that the budget is there. We can't really say someone is sitting there saying, I won't allocate funds, I won't allocate personnel, and just watch the state of health, especially in provinces like the KZN, deteriorate in the way that it has been over the years.
I think it goes back to the political will. I mean, those who are sitting at these provincial departments, at some point when you sit around the table with them, they'll tell you, we really do not have power. The power sits with politicians who are non-clinicians, who decides where funds needs to be directed at. So the biggest frustration in our healthcare system in our country is that it's still very much controlled by politicians and not necessarily by the managers who are managing health, and also by the clinician or even the researchers that would know where we need to be placing this particular fund. So political will is one of our biggest things, but also meddling of these politicians. Even when programs are put together and we know exactly what needs to happen, we see them meddling, we see them redirecting programs that are supposed to benefit our people, and that is really a problem on its own.
Now, going back to the KZN floods, I mean, the floods have destroyed a lot of infrastructure in KZN. The lack of water and electricity means that maintaining cleanliness and hygiene within these health facilities is going to prove to be more difficult in the long run. How is medical personnel currently coping under such circumstances?
I think we went into the COVID-19 pandemic ill-prepared. Literally, the healthcare system was in ICU, if not in mortuary. So that added a burden, just being in the pandemic itself. Now, KZN as a province, now dealing with a triple jeopardy, they are not coping. And I think what is vivid and clear is that we could not even see speedy aid coming through. We didn't see temporary structures being erected so that patients can get basic necessities. We didn't see anyone being rescued. I mean, you would expect, if you're looking at those floods, to see, choppers going out there and assisting people, delivering aid, delivering medical supplies. Not in our country. In our country, it's politicians will walk in and say, we are here, Skalanani. It's so barbaric when you expect these people that we've voted them into power to be doing something to save lives and continue saving those who at least survived those floods. And we are not seeing that.
Now, just quickly, Lerato, we know that with floods come enteric diseases such as cholera and typhoid. And government did say that they have plans in place to mitigate all these. You don't seem to have much trust in them.
No, absolutely. They don't have a plan. They have lip service. They will claim that they can be able to assist when we get all these enteric diseases. The whole flooding disaster, also on top of all these diseases that you've just mentioned, also add diseases that are acquired in the hospitals because we are in unhygienic spaces. So you can imagine they don't have any plans. We are going to have people not just struggling to recuperate from the floods, but also not being able to be treated well in the hospitals. In fact, that's where we end up saying people are better off when they're not even in a hospital, because coming to hospital, you're going to acquire more diseases.
Sure, that is Lerato Mthunzi, the Secretary General of the Young Nurses Indaba Trade Union, telling us there what some of the problems that the region of KZN is facing post the floods with regards to the healthcare system. Thank you so much for your time.